Hey, good morning and welcome back in. Well, over time, our pets certainly become part of our family, and caring for their health and well-being is very important. It can be difficult sometimes to tell what's wrong, especially if the issue is internal. We wish they could talk to us, but they cannot. Dr. Katie Locke, though, leads Move, a mobile company that conducts endoscopies for pets, and she's also here with our regular guest, Dr. Jerome Williams from Red Mountain Animal Clinic. Good morning.
Good morning.
Good to see all of you.
Yes.
All right, so for something, would you refer someone to someone like Dr. Locke, or how does it work?
Yes, and this season especially, her work is most important. She can use a scope to go down through the mouth and look inside the stomach to see if there's a foreign object there and retrieve it rather than the old method of having to cut them open to take it out.
What is the most common, Dr. Locke, that you find?
Yeah, so just like Dr. Williams said, the coolest thing about it is it's non-invasive. We don't have to do surgery or have an incision. And so it's this little tube that has a camera. We snake it all the way down there. And just like Dr. Williams said, our dogs and cats, they love to eat things they shouldn't. So, I mean, just last week we found some leather silicone rings, plastic, garbage, sticks. So they can eat quite a lot that they shouldn't.
So when you say it's mobile, how does it work?
So mobile meaning, a lot of people ask us, do you come in a truck or a van? And so the cool concept is that we actually come to our general practitioner's clinic and perform that service there with them.
So the equipment is
we
portable.
bring all the equipment portable into the hospital, and we rely on our general practitioners. They're with us step by step. And so they're performing anesthesia while we're performing the procedure. So whether it's the GI tract or the respiratory tract or the urinary tract, we're able to scope multiple organs.
How does that help a general veterinarian? What difference can it make for you?
Well, for those of us that don't do scoping within our clinic, a mobile practitioner like Dr. Locke makes it so much easier because we do x-rays. We think we see something, we're not sure.
Sure.
Only we'll know is to do surgery and go in and try to find out. But she with that scope can come to our office. The scope is it's a tube really, and the whole setup is no bigger than a desktop computer.
Now, we know there is no monetary value we can put on the love of our pets, but is this help people for you to come to the regular veterinarian's office rather than having to go to an ER?
Right, so a lot of times it's travel, it's stress, it's having to go to an environment that you're not familiar with. And so this provides the pet and the client their home environment, their veterinarian that they've known for years, and then also saves them time and some money for us to be able to come in and do that there.
Because part of the stress is going to an ER with your pet unknown.
Right, and right now, I mean, our ER veterinarians are on the front line. They're very overwhelmed and they're doing fantastic, but sometimes this relieves a little bit of their pressure as well for us to be able to go in with our general practitioners.
So anyone watching right now, I mean, what do they need to know? Do they need to ask their veterinarian if they've never heard of what you do, if there's an issue?
Yep, so we try and go around to the greater Birmingham, Tuscaloosa, Pell City, Talladega area and get all our information out. And then all Dr. Williams does, he'll give me a call once a week and be like, hey, I have this case, or I have a question. It doesn't necessarily mean I have to go to the clinic. We always are free to just chat about a case.
All right, well, Dr. Locke, thank you. Thank you for what you do. And look, he was good today.
What's going on here?
I don't
Maybe
know.
It's Dr. Locke. Who knows?
It may be. He doesn't want that endoscopy. All right, thank you both so much.
Okay.
All right, we'll take a break. We'll be right back.